To restart, last minute, to start with the minutes, last meeting we voted on House Bill 305, and we started hearing in regards to House Bill 811, the what ifs regarding Department of Community Health, and questions were brought up along the lines of, could DCH do this? Would DCH do this? And to that end, we actually have DCH on the call today, but we'll get to you just a second, Melanie. And with 430, we heard a little bit about some of the fiscal impacts. We heard again from Drs. Eichelberger and Dr. Clements, but we kind of held on that because we had gotten a fiscal note request that day. So that's kind of where the last meeting was, where we ended on the last meeting. So I just want to get a quick approve the minutes and we can move on with our day.
This is Kelly. I motion to approve.
Thank you. Do we have a second? To approve the minutes.
I'll second that.
Thank you. Okay. So moving on, just a quick little bit of housekeeping. So I said last week it was hot off the press that we got a fiscal note request for House Bill 430. So it is literally hot off the press that we finished that fiscal note. I just posted it to OPB's website. Legislative members, it just got emailed over. So it is hot, fresh off the press. It is on OPB's website under the fiscal notes. So anybody wants to pull it up. Council members, Charmaine should be sending it out to you guys immediately. Nothing really changed from what we discussed previously from Gabe, but just as an FYI, it was done and it is on, it's available for everyone. Okay, so back to previously what I was mentioning regarding House Bill 811. Last week, we kind of discussed, as it is current in statute, it is in statute that directs the education requirements to a DCH rule. We reached out to Department of Community Health to see could they make those changes in so much as like a DCH rule change or of that nature. So Melanie Simon is here with us today. Melanie is the Executive Director of Healthcare Facility Regulation Division at Department of Community Health. So Melanie, if you could kind of speak to that end, that'd be great.
Sure. So the Department of Community Health licenses and regulates 25 different types of healthcare facilities. And one of those is X-ray sites. So we actually register the X-ray site. It's a registration process. And we send out a field surveyor inspection. And one of the requirements, one of the things we look at as part of the inspection or survey process is the qualifications of the X-ray staff, the medical technologist. And so we evaluate that. So that's in our rules. The credentials and qualifications are actually in the department's rules. And so if those credentials and qualifications were to change by virtue of statute, then we would change our rules to reflect whatever the new statutory requirements would be. So that would be just through a rulemaking process that the rules would be approved by our board. It's unusual to have a legislative session where we don't have some rule changes just because we regulate so many different types of healthcare facilities. So typically we are always bringing rule changes in the summer after the legislative session to make any changes reflected in our rules that were made during the most recent legislative session. So that's kind of the general background. I don't know if you have any questions about the specific proposal, but that's sort of our process and our role.
I have a question. So essentially, y'all only amend and update the credentials based on a statutory change and not based on any type of, I guess, assessment as to what type of level of care is necessary.
It doesn't have to be a statutory change. We make changes for other reasons as well. When we go before the board will want to know the reason for the change, but it certainly doesn't have to be something that's mandated by law. We sometimes make changes where there is a conflict or a difference in federal regulation, if that's a factor, for example, or just because we think there is a safety or quality issue. So It wouldn't have to be in response to legislation. We would certainly be able to make a change for another reason. We just have to articulate what that reason is. It's certainly easier to get board changes through if it's mandated, obviously, right? But that wouldn't be the only reason. If I had to think of a recent example, a few years ago, we worked with public health and we changed the disaster preparedness requirements for assisted living communities and personal care homes, just in response to what happens when we get a hurricane threat, right? And what we need those facilities to do. And we worked with public health and we made some changes to our disaster rules. And it wasn't any statutory requirement. It was just a realization that the process needed to change. Previously, we had reviewed a written plan and, now everything's electronic. So we updated our rules to reflect the way that emergency preparedness is done now. So that would be a recent example. We do have a lot of statutorily required changes. And so that probably is most of our rule changes, but there isn't any requirement that it be based on statute.
This is Kelly with SAO. Just to clarify for me, so barring any opposition, you all could implement the changes that have been requested as part of this particular rule, correct? The additional strengthening what the requirements are.
Yes, we could do so. If that's the decision of leadership with the approval from the governor's office, then yes, we could bring forth some rule changes that would increase the credentials and qualifications required for the technicians.
Okay. And I think you might have said it, but I missed it. How are you doing this annually? Is that how often it is the checks?
Well, so no, so that is a significant vulnerability. So right now for X-ray, we do an initial inspection. We actually, because we have vacant positions and the medical technologists are in such short supply and difficult to recruit to government work, we have vacant positions in our X-ray program. So what we have been doing is for X-ray sites that are waiting to be registered, they can use a private company to do the inspection, and we will accept a private inspection so as not to delay their registration because we do have a backlog. And we aren't really doing any interval inspections at all right now. We're basically doing the initial and we're doing complaint investigations. So that is a vulnerability, and that's just a staffing issue for us. We wouldn't have, even if our positions were filled, we wouldn't remotely have enough staff. There are almost 10,000 X-ray sites registered in Georgia, and I have 2 people in the program. And one of them also does mammography, and those we do under contract with the Food and Drug Administration. And because that's a revenue contract, I really have to prioritize that work. So it's a very limited bandwidth for any inspections. So while the requirement would be in place, we'd be limited in what we could do in terms of actually enforcing it or putting the oversight there.
I have a follow-up on that. Just so I'm clear, though, whether this is statutory or regulatory, adding the change, that's not going to be affected by the staffing changes are still going to, or staffing limitations are still going to be there. Is that fair?
Yes, that is correct.
Yeah,
yes.
I just wanted to clarify that. Thank you.
Yeah, thank you.
And this is Kate with DNR. I have another follow-up question. So, and one of my main concerns is obviously y'all can easily change the rules to update it to what is, kind of seen as normal or the minimal requirements for people to have these types of, I guess, certifications. I don't know if that's exactly what we call it, but are y'all going to have the bandwidth? And it seems like you don't have a very high bandwidth already to keep up with changes and amend the rules as necessary. Because I think the problem to me, the disconnect is that right now, I think the rule requires only 6 hours of training. And that just seems on its face really inadequate. And we've gotten to this point where DCH, I guess, on its own hasn't updated the rules to make it more adequate. So if y'all are gonna, I guess, change the rules, how can we ensure that they'll be updated as updates, are necessary?
Well, I mean, that's difficult to answer. So to be honest, we spend 90% of our time on long-term care right now. So it's nursing homes, assisted living communities, and personal care homes. And we can't keep up with the rule changes for those. And that's where the majority of our staffing challenge is. That's where our vulnerability is on the federal side with our funding. And so I can't really answer that. I mean, a rule change is not that big of a deal. I draft most of them myself, to be honest, because our legal team is really absorbed with hearings and that type of work. So I think I've done 15 sets of changes in 6 years. It doesn't take that long to do a rule change, but whether the department would be able to keep up or not, I don't know. I think we would want to draft it in a way that, if it has to be updated frequently, that's almost not appropriate for a rule change. We try to make the rules broad enough that they do last for a period of time. So I think we'd want to think about how to draft it. I don't know if there's a national set of standards that we could reference, or something we could reference where the rule wouldn't have to continually be updated, but we would get the safety that you're looking for. So that we could maybe consider that and how we phrase the rule. But I don't know how to answer the resource question, because I will be honest with you. We have a long set pending now. We have a long list of rules pending now, some from legislation in 2019 on criminal fingerprint background checks that required 8 sets of rule changes, and I think we've done 3 of those. So it is a consideration. Maybe there's a workaround with how the rule is drafted.
Anna, this is Kelly. I agree with Stephen that the amount of labor we have to do these things, even for almost anything in the state, isn't going to change no matter if it's regulatory or statutory. So I think in our last conversation, we talked about, or someone questioned, well, what if we try it this way and then it doesn't work? Like we go through adding the regulation to DCH, and if it just doesn't give the bang for the buck that we want, we can always move to statutory. So is that still on the table as an option? I don't know what timeline that looks like.
I would agree, Kelly, with what you're thinking there. And this is me. I'm coming from the Department of Revenue perspective. I was in the legal division. I'm sitting in the interim in the commissioner's office right now, but I've got a lot of experience personally with regulations and regulated industries. And if I were in DCH's shoes and I was asked by this committee to prioritize a regulation, even though we have a lot of regulations we would certainly love to update and don't have the manpower for, if it was a priority and it was going to save the headache of having to go through the legislative process, where frankly I lose a lot of control over things, I could see myself. I wouldn't have a problem personally moving forward with a regulation. And then Kelly, to your point, if it doesn't work or if it's insufficient, we can certainly work with the lawmakers who have brought this to the committee's attention and assist in giving our feedback so they could bring legislation and get it right. But if the legislature's delegated that authority to do these regulations, it simplifies things, I think, for everybody to just do a regulation. That's just my opinion.
Thank you, Stephen, for mentioning that. I just want to kind of bring back the conversation to like what specific thing we have to address in regards to this bill. So what we're tasked with when we get the notification to do a study on any bill is look at the bill as is currently written. And we've really dug into this one because this is a new type of licensure. So we've dug in a little more to this one than we have in bills we've recently done because they are just like edits to current licensure. So one of the things that we have to look at is is there a current harm being done to Georgians by XYZ thing not existing. I think we can all agree, and we've all said that yes, the 6-hour rule at Department of Community Health is currently inadequate to the training to what education requirements exist for radiation therapists, radiologist therapists, sorry. But the other thing we have to look at is there a way other than state regulation to accomplish this goal? The staffing thing is going to be a thing no matter what agency you go to or talk to or anything. I mean, we're all like, no, we don't have enough staff to do these things. So I think wherever it would go, the staffing thing is kind of not to take away from your point, Melanie, about not having enough staff. It's not what I'm trying to do at all. We'd have to figure out staffing situation regardless of where we went to live is kind of, I'm sure, what Stephen was getting at and Kelly was getting at. So I think what we have to look at here is, okay, of the current draft of HB 11, what is the recommendation going to be from our council moving forward, knowing that the bill currently doesn't actually say where it's going to live. It doesn't actually specify Secretary of State or Composite Medical Board. That's why we had them both come and talk about it. So, while we're looking into that, is there a way other than state regulation to look at it? It has popped up. Yes, there might very well be a way to do it without regulation. And that's kind of what we're tasked with now. I would think the specifics around what a DCH rule would look like wouldn't be written by our council or anything like that. What would come from this would be a recommendation of the passage or not passage or recommended changes to House Bill 811 is currently written, is kind of the posture of what we are trying to figure out here. So just to try to kind of bring back what we've talked about. We've been talking about this one for kind of a hot minute here, and I've had a lot of people talk about it, and I appreciate everybody's conversations around this, and this is very beneficial, but that's the kind of the lens that we're talking about. I'm sure that because we have had such interest in this, I've spoken to the new leadership over at Community Health, and I'm sure that we could get a rule change, a little bit more interest in it if that were to be the decision of this council. Though I can appreciate how long it takes to get a rule change. Just in general, I've had to go through some of that sort of stuff on my own. But that's kind of the posture that we're at here. And I'm getting some feedback from some folks. I'm about to meet some people, so. Any other council members kind of want to speak to those points and just kind of generally where we're at with this? I will mention that I did speak to the bill's sponsor earlier today about this, and she is favorable to the thought as long as the education requirements get addressed in some sort of a manner. She is supportive of whatever manner that is. So if we can make a rule change, or again, we GORT can't make a rule change, but we can make a recommendation to go down that path. Then, like I said, she was okay with whatever mechanism we kind of came out of.
So I would suggest that it sounds like even the regulation through the board would go faster than through the legislature. Is that a true statement? Possible true statement?
I think, not to knock on our legislative friends, but rule changes typically can go faster because you have to wait for session and then wait for session to be over and then wait for bill signing.
Yep.
Yeah, it's statutorily, it's about 50 days from the date that you've got a final draft to it taking effect. You'll have to put it out for comment for a minimum of 30 days. Then you have to have a hearing, and then there's like a 20-day cooling off period on the back end of it. So as soon as you would have a draft, it's about 50 days.
Yeah, it usually takes more like 90 days for us, but that's accurate. We usually do, we do initial the first month, we do the public comment hearing the second month, we do final adoption the third month, and then it goes to the Secretary of State.
Then there's always the chance that there are higher priorities in the legislature and it goes to the next session.
That's a good point.
I guess with that, I mean, Anna, can we make a motion now? Do we want more discussion?
I think it's appropriate to have a motion now. We kind of
So I'd like
discussed,
a motion that we recommend that it go through DCH in the regulation process, encompassing everything that they want as far as changes.
sure, and I want to, I have sent out, so part of this is we collect findings, and I've alluded to this, and then we have a recommendation. So I sent a draft around to the council members, but I just wanted to take a minute and read what we had drafted that kind of seems to have led to this. So what we found was that the practice of medical imaging and radiation therapy requires a specialized skill or training. And due to the technological advances in the field, council finds that the current minimum of 6 hours is insufficient to administer medical imaging and radiation therapy procedures. But again, as I just alluded to, citizens of the state may be protected by other means. And then we kind of, by amending the educational standards and the DCH rule, it would mitigate the risks of undertrained or non-licensed individuals by administering that radiation. So we will have those findings attached to whatever recommendation we vote on. So sorry, Kelly, I wanted to say that before we started to take a vote.
No, that's great. And for me, it's really, I think we go through this plan A, and because I think it will go faster and we'll get the results faster. And then if for some reason we look down the road and it's not working, either there's an additional fiscal note to get DCH additional staff that are targeted towards this, or it goes through the legislative process. I mean, that's just my thoughts and opinion. That's why I wanted to offer that up.
I'll second that motion if that's appropriate, that we recommend it not pass and go forward with the DCH regulation amendment.
Okay. Thank you for that second. So I want to make sure we get the vote on this rather than just everyone say yes at once. So I'm going to go by agency. So Department of Ag. So we're voting on do not pass as currently written, recommend the applicant group work with Department of Community Health to get a rule change.
I vote in favor.
Thank you. Kate.
I'm going to say nay.
Okay. Department of Public Health. Megan.
I'll vote in favor.
Stephen.
I'm voting in favor of the motion.
Okay. Sam.
Aye.
Kelly.
In favor.
I will vote aye. Do we have our Senate member on the call? I don't know if Dr. Watson is able to jump in today or not. Okay, I will count him absent. And then Representative Earhart, are you voting for Representative Cooper today?
Sorry, I was muted, not voting on this one.
Okay, great. Perfect. Okay, well, the ayes have it on that one. Council members, thank you for your work on this bill. Applicant group, thank you for your responsiveness to this. We will have a final report fully up on the website and ready to go by the end of the week. So thank you for everybody's participation in this. So y'all are good to log off if you want to, because we're going to move on to 4:30 now. So thank you, everyone. Okay. So as I alluded to, we got the fiscal note hot off the press, and I can get the right buttons up. I will show you. Nothing really substantial changed. Forgive me, Teams has changed its. Nothing really substantial changed to it, but it is finished and it is up. All right. Everyone see that now? Can we all see it this one out? We just assume, yes, you can. So again, we just go over what the one-time expenditures are going to be. I'll just show this breakdown here for the licensing system. So it'll be like a one-time cost for setup of 266,000, and then annual expenditures of 124,000, with new licensees estimated around 75,000 annually, and annual renewals at 585,000. So any questions from the members on that? You should have gotten an email from Charmaine. If not, it's on our website. We'll make sure everyone gets it. Okay. So Dr. Eichelberger wanted a couple of minutes to speak. So I'm going to give you, so we're moving quick. So I'm going to give you 2 minutes. Can you do it in 2?
Yeah, I'll try.
Okay. So
Thank you very much. I just wanted to make a couple of points about the workforce questionnaire because I think there was some confusion when I was speaking last time. I just wanted to say that House Bill 430 in no way mandates that the Georgia Board of Nursing would have to collect this data. It would only grant the board the authority to require the collection should they choose to do so. We have tried for 7 years to collect this workforce data with the current voluntary system, and it is not working. And twice we have gotten a ruling from the Attorney General's office that we cannot require the questions without changing the law. That's the reason we've come with House Bill 430. And so, you know, I'm thinking about the definition of insanity is where you keep doing the same thing and expecting different results. Well, please don't make us continue in this insanity by asking us to continue to do this and expecting different results. You know, Georgia has the second highest maternal mortality rate in the nation. And it's safer to deliver a baby, twice as safe to deliver a baby in Uzbekistan than any county in Georgia. And in 2020, our health system's performance rating dropped from 42nd to 46th. And we can't tell you even where any nurse midwives are practicing in the state of Georgia because we have no data to tell you where any nurses are working in Georgia because we can't require them to fill out this survey. And this workforce questionnaire is not like an opinion survey where we can extrapolate results simply because we got 40,000 nurses to fill out one or more questions. We have to be able to tell you. It does us nothing to know where Fulton County nurses are working because there are 158 other counties. It does nothing for us to know about Fulton County if we don't know about the rest of the counties. So nurses have a 3-month window to renew their license, and it takes less than 10 minutes to answer these questions, yes or no, or a drop down. And I know because I have personally filled out this questionnaire 3 times in the 7 years we've tried to get them to do it. So if you didn't learn anything about the healthcare in the pandemic, you know that nurses are the backbone of our healthcare system. You saw it in COVID, and we've got to have accurate data in order to know where our shortage areas are and to develop workforce solutions. So I am begging you, we're doing the exact almost identical questionnaire for our dentists and dental hygienists in Georgia law. Right now, we're mandating that they do this survey. So I'm please asking you to allow us to collect this data for nurses. I think it's vital. We wouldn't be asking you to do this if we didn't think it was vital for health care here in Georgia. So thank you very much for allowing me these couple of minutes. Thank you, Anna.
thank you, Dr. Eichelberger. So I don't really have anything other to share for the council members. Beyond that, I think we're kind of to the point where we should need to have a discussion on the posture of how we're going to move forward with the recommendation in regards to this. I will read through a finding that we came up with for this one. Oh my gosh. The finding that we have for this one is the occupation of advanced practice registered nursing requires specialized skill and training, and licensing individuals will in this profession would assure Georgians that the individual has continually met education requirements and professional standards necessary to hold a license and practice in this state. And beyond that, I'm looking forward to the statewide compact that's probably going to come regarding nurses, and this would just bring us up to parity with other states, like we've been seeing with other this council has been seeing with other professions. Representative Earhart, go ahead. I see your question.
Right. Yes, thank you. Can you hear me?
Yes, I can.
Okay. And I just wanted to weigh in a little bit
Sure.
and I'm very supportive of HB 430. I think that Dr. Eichelberger and Juliana know that I've had some questions in the past. They've been very helpful in forwarding information to me as relates to the workforce data, or the questionnaire, as I like to call it. And I just want to kind of weigh in, because I haven't necessarily heard this mentioned, and I've sat through, I think, 3 GORC meetings now as relates to HB 430. And, one thing I'm not hearing, I know that Gabe Sterling had some concerns essentially about the fiscal note and just the costs associated with the implementation of this process and the new licensing. I did want to just kind of weigh in on behalf of what I just consider Georgia citizens in general. And I certainly can speak to the interests of and the opinions of my constituents in Cobb County. And I have heard from some nurses. I speak as the mother of I'm the mom of an ER trauma nurse at Kennestone Hospital. I come from a family of nurses, and I have great respect for the need to compile this workforce data. I want to qualify by saying that I'm a pro-business individual. I really am. So anything that we can do to make nursing better and more efficient in Georgia, I support. I would be remiss, however, if I didn't at least mention that my role as a legislature isn't just to be concerned with the business side or the workforce development, but also the rights of Georgia citizens. And so I just want to kind of weigh in that I don't take any of this very, very lightly. Essentially, what you were saying to Georgia citizens is that in order to practice your trade, in order to engage in your chosen profession, you will be mandated and required by the state of Georgia to complete this questionnaire. Mm-hmm. Right, so it is not optional. I understand that some nurses now are not completing the questionnaire. I would be interested to know why. I know that a lot of nurses have issues with privacy concerns. I dealt with an issue really within the past year where we had issues of safety concerns at one of our local hospitals. A lot of those nurses treat a lot of psych patients, and they are often threatened. My own daughter was threatened, and many of them were concerned about the fact that their first and last names were on their name tags. Many of the nurses started taking a little piece of black tape and putting it over their last names so that patients could only see their first names, because they were concerned about being harassed or harmed outside of work. And my daughter has been threatened to I'm going to hunt down and kill you. We're talking about psych patients that come into the ER. So my concern about the safety, and certainly I know that's not the type of concern that would be related issues of privacy, and I want to be mindful and respectful of them. One thing I did hear last time that concerned me a little bit, and that was the comment that the Georgia Board of Healthcare hides its opt-out button. And I heard that, and I was concerned when I heard that. I understand. I think the phrase that was used is they have tricks for tricking people into completing these questionnaires. I find that concerning, and I find that problematic, if that's what is occurring, certainly. So anyway, I just like I said, I just have some concerns about this. I don't know if these are necessarily the concerns and issues that need to be vetted and gone through the GORC process. I imagine that these issues may come up in committee when we get back into the committee. But HB 430 right now in section 3.1, lines 304 and 305 reads that the essentially, the Board of Nursing will be authorized to require the collection of workforce data from applicants when issuing and renewing licenses under this chapter. Is it what workforce data? I mean, I know what the workforce data is right now. I've been given a copy of the questions.
Right.
Is there, I don't see anything here in code that's saying that this has to be non-identifying information. I understand that the contention right now is that this is non-identifying information. Well, it's identified information to the Board of Nursing. It's
Right.
just my understanding, it's just not going to be identified when whatever is done with this information is sent out to other people. I get that. There's anything here to say that in the future that you could start requiring identifiable information. I don't know that I see that protection here. So, you know, I'm still a little unsettled about it. I just kind of wanted to voice that. I want to strike a balance here. I have every respect and an understanding of the reason that we're requiring this workforce data, or why you want to have it. I absolutely do. I just believe that in my role, I want to make sure that we are balancing this with the needs of our citizens for privacy, and to not be required or compelled with threat of not being able to practice their trade in order to complete a questionnaire. And I hope I made that clear.
No, I thank you so much for those comments, Representative Earhart. I think several of us have kind of had the same sort of thought process on, you could be the most well-intentioned individual, but this in essence is like, we can require them to say kind of whatever in the future, because it doesn't actually say non-identifiable things of that nature. And I work with survey data quite a bit. I work with census data quite a bit. And what I've learned from requiring surveys from people is that if they're not responding they're not responding for a reason. And if you make them respond, they're not necessarily going to be truthful in their responses. So I've seen responses where people will then put like Jedi for my race and my, you know, I work in Mars, and like, you know, I want to just say two things. You know, there's three parts to this bill, and I'm in full support of two of them. And I don't, you know, again, we're not the legislature, but we could, I don't know, if pulling this third one out to be not attached on might be a beneficial way to move forward. So you can kind of work with the legislature on the wording, I think, is the part about this, the phrasing of what you can and cannot, what this would and wouldn't allow. And I think the implementation method is kind of going to be the trick, because again, you're exactly right, Representative Earhart, the hide the button kind of thing was like, okay,
Yeah.
maybe there's a better way to do that. So I don't know. So all of that to say, I think I'm not discounting the need and the effect that workforce data would have on the nursing profession. I think absolutely it's needed, but I don't know if as currently written, and again, I'll give my same little spiel as I did earlier, we're tasked with looking at the bill in front of us. We don't have the kind of flexibility of the legislature to just like whip out a new draft and start going to town on it. We just can kind of make recommendations about what's in front of us. So I echo Representative Earhart like completely on. I'm just a little bit concerned about the implementation of a required survey for licensure, because I don't know if you will be getting good data, though you may be getting more of it, if that makes sense, because if people aren't responding, they may just not respond correctly or be very vague, that sort of thing. So I know I'm looking at the time now, so I don't know if we want to get to a recommendation, because again, I don't know if pulling that one thing out might be the best kind of way to go. But I think for our purposes, we're all kind of at a consensus that there is two things that we're like, yes, absolutely, I see the need for it. And the other one is just, it's not the idea, it's implementation that's currently on the paper. That's the heartburn. You know, council members, please feel free to jump in.
This is Kelly, and I brought this up in the last discussion that I was concerned that we were going to make a requirement when we have such a shortage of nurses, and certainly I'm not as astute in all the knowledge around that. But just in my work, and like you're talking about the census, I have similar concerns, and I'm a little concerned that those who are on the fence of retirement or moving to another state or something like that, this, even these little things sometimes push someone to the, well, I don't need this Georgia license. I'm not going to fill out the survey. So I'm in agreement with Representative Earhart and Anna that we say yes to the licenses and everything except for those surveys. And if that's something I can put into motion to start that process, or if we want more discussion.
I think I'm ready to have a motion on that end. So something like
I'll make the motion to say yes to all except the required surveys.
So I think how we will record that would be the council votes to approve the bill parts of the licensure of the APRNs and the writing of the handicap passes, but do not recommend the current required survey language. And then that can be left up to the legislature on how they want to move forward with redrafting the bill, but that kind of gets across all of our kind of, I would say, concerns on the draft. Because again, we're looking at the specific draft of the bill, the specific LC that we have.
You say it much more eloquently than I do.
I've written one or two of these before. Representative Earhart, does that kind of would that address your concerns?
It does. It certainly does. Thank you for that. I think there could be a host of reasons why an individual might be hesitant or reluctant to fill out the questionnaire. I would like to also just again voice my support for Dr. Eichelberger and all she is doing for this industry in Georgia. I respect her gratefully. I would love to continue to maybe have conversations about a way to maybe another way of addressing the issue of workforce data. Certainly to tighten up language here, because as written, that particular part that we're talking about really sort of doesn't put any limitations on what this data might be that they're looking to collect. So it just seems like it's got a hole in it here that you could drive a truck through.
Right, absolutely. And we'll be glad to work with you on that. Right. Thank you so much, Representative.
But yes, I would agree with your suggestion on the approval of the two parts and not the third.
Okay, so I'll take that as a tacit second there to Kelly's motion. Representative Earhart?
Yes.
Okay.
That's a second.
Okay, so we'll say second for her. I'm going to say yes. Kelly, how do you vote? I'm going to assume yes.
In favor.
Sam?
Aye.
Stephen?
Also in favor of the motion.
Megan? Megan, Public Health?
Okay, sorry. I'll vote yes.
She may have dropped off. Kate?
Yes, in favor.
Okay. And Bo?
Department of Ag is in favor.
Okay, great. Thank you, guys. And thank you so much to Dr. Eichelberger and everyone, because again, we really appreciate what you guys do for the state as a whole, and we really appreciate everything. So thank you to everyone. If you were here for the nurses, you can drop off. So I apologize to the behavioral analysts that we are leaving them with 15 minutes, but the good news is I'm devoting the entire next meeting to you guys. So whatever we don't get through today, please don't rush. I'm going to leave time for you to do whatever you need to do. So first, I'm going to let OPB does their own little review on the summary of the bill and then a statewide comparison. So Matthew, be very brief with this. So let's get it real quick so we can turn it over to Representative Dempsey.
All right, thanks, Anna. So HB 412 would amend Title 43 of the OCGA to create the Georgia Behavioral Analyst Licensing Board and provide for the licensure of individuals practicing applied behavior analysis. Applied behavior analysis means the design, implementation, and evaluation of systematic instructional and environmental modifications by a behavior analyst to produce socially significant improvements in behavior. Behavior technician means a paraprofessional who practices under the close ongoing supervision of a licensed behavior analyst or licensed assistant behavior analyst and delivers services as assigned by such licensee but does not design assessment or intervention plans or procedures. Certifying entity means the Behavior Analyst Certification Board or its successor or another entity that conducts programs to certify professional practitioners of behavior analysis that are accredited by the National Commission on Certifying Agencies or the American National Standards Institute as identified by the board. The Georgia Behavior Analyst Licensing Board is composed of 5 members appointed by the governor. A license shall be granted and it will be valid for 2 years. Temporary licenses, which are no longer than 14 days, are available for board certified behavior analysts or assistant behavior analysts residing in another state who temporarily provide applied behavior analysis services in Georgia. The board may issue licenses to individuals actively licensed as a behavior analyst in another state with comparable licensure requirements. For the statewide comparison, 31 other states currently require state licensure for board certified behavior analysts, according to the Georgia Association for Behavior Analysts. GABA is seeking licensure to, number 1, specify requirements for obtaining and renewing a government issued credential, and number 2, determine the composition and operations of the board that will manage credentialing, fees, ethical and discipline standards, complaint and investigatory procedures, and sanctioning authority. Indiana and North Carolina will become the next states to license behavior analysts, according to the nonprofit Behavior Analyst Certification Board. Licensing behavior analysts is a relatively new trend, as Oklahoma and Nevada were the first states to require licensure in 2009. Applied Behavior Analysis edu.org classifies states into 4 categories: state license available and BCBA license required, state license available and BCBA license optional, no license requirements but legislation proposed, and no governing body or licensing requirement. HB 412 requires applicants pursuing licensure to comply with BCBA standards or standards of another qualified certifying entity and proof of continued certification by a certifying entity for license renewal. Anna, back to you.
Thank you, Matthew. So again, like I said, we'll have the entire next meeting devoted to just this bill, so don't rush any of your presentation. If we want to just have Representative Dempsey speak to the bill today, and Wendy, if you just want to do your whole thing next week, that is fine with me. But Representative Dempsey's here, so please speak to your bill.
Well, and I as well can join again.
Yeah, okay.
Next meeting. I don't know, we do have a few experts on the line, and I would say it might be good to see if they are available or if this is their moment when they need to step forward. I believe Wendy Clifton may be handling that right now.
Okay.
Hey,
Wendy?
Madam Chair. Yes, ma'am. Hey, Anna, how are you? Yeah,
Good.
Colin Muthing is on here. And when is the next meeting, Anna?
2 weeks from now, so the 4th.
The August 4th. So Colin, it's up to you, buddy, if you want to try to do the PowerPoint. It's about 15 minutes, Anna, and that would put us about 5 minutes after 4. So I defer to you, Anna, if you want him to proceed with that. We're happy to do that if that's what you'd like.
Colin, if you're available next time, if you're available in 2 weeks.
I am.
Okay.
I can do 2 weeks.
For that, just so we can have a good, robust questions if they naturally were to come up.
Okay.
Would it be possible, since I'm a layman here and we only have 10 minutes, would you guys maybe help me better understand like the work environment that you're going to be going into? Is this going to be for like elementary school children with learning disabilities and language processing and things like that? I'm just struggling to understand where these types of individuals would work.
Sure. So I can start with that. It's going to be a wide variety. And so there are behavior analysts that work in schools, targeting, skill acquisition or reduction of problem behavior or things like that. I wouldn't say it's like designed specifically for any sort of diagnosis, right? It isn't. It is a human behavior, as well as animal behavior and everything like that. So you have people all the way from working with like animals, which is an exemption that we put in the bill, to people working with pediatric populations, to people working with traumatic brain injury. I would say on the whole, kind of the people that do the most work is with with individuals with developmental disabilities, whether that is kids or adults. So you'll hear a lot about this, like when it comes to autism and things like that. But there's also behavior analysts that do organizational behavior management type things. So they work in businesses and kind of evaluating human behavior there. They're obviously exempt from the bill as well. All that to say, like, behavior analysis is not tied to one thing. It's a very wide kind of array of professionals. But when you want to like tie it to like what most behavior analysts do, I would say it's working with individuals with developmental.
Okay, that's great. Thank you for that. That helps a lot.
Okay.
Are there any other questions that you feel we need to address today, just to get y'all sort of focused on what it'll be? And then it sounds like we'll kind of pick it up and give you the full story
Yeah.
at the next meeting.
I did just have a question, just reading through the bill. Why would there be an exception to licensure for individual employed by the Board of Education? Because they work with kids, so that is just the one thing that has really popped out at me. So I was just on my list of things to ask. So since we have a minute, I thought I'd share.
Yeah, and I can get, we've worked really closely with Dr. Gina Green, who's the CEO of the National Association for Professional Behavior Analysts, and they work with all of the like licensure and kind of like any kind of, bills surrounding kind of like delivery of behavior analysis. And this has come up in other states. The reason being that like, people who are employed by the school system don't always have their BCBA, but they are functioning in a capacity where they're providing services that are behavior analytic in nature. The requirement then to put in that all school systems would have to then get all of these employees kind of certified would be undue kind of towards the school system, is how it has been proposed in other states as well. Does that make sense? Being clear. I also don't work in the law field, so I'm using words that are probably not in my vocabulary very well. So
Fair. I saw one little question come through the chat from Kate Marr. Will other associated professionals be included in the verbiage? SPLs, audiologist. I actually have heard from the SPLs, and they're going to be speaking at the meeting too. I don't know if the audiologists are yet.
Yeah, I mean, we've put a lot of different things in the bill that define the scope of practice of behavior analysts. And so specifically, outlining that like behavior analysts would not be licensed to diagnose, provide, that the sort of therapy that a psychologist would, and things like that. So we've tried to really define the scope of practice of what we do, and how it's not infringing on the other professions.
Okay. Well, this is one of the instances where my eyes were larger than my stomach, as it were, with making an agenda for today. So again, thank you guys for being here today. I'm sorry we didn't have a longer time with you all, but hopefully you got to see a little bit of how the process works, particularly with another new licensure type. So again, reach out to me if you have any questions in between now and then. Anybody that you want to have speak to your bill, be sure to invite them. Send them to the GORC email so I can have a list of who's going to be speaking for the bill. But I'm happy to have anybody who want to speak for this licensure. This is a public comment period for them as well. And like I said, we'll have the whole meeting just to you guys next 2 weeks from now. So same time, same place. So thank you all, and thank you council members for working through all of this. Busy day today, so hope you'll have a great rest of your day. Anybody has any questions, let me know. We'll have the video posted probably tonight. It takes a minute to render. We'll have minutes up maybe by Friday, and we'll have 2 final reports for our last 2 bills sent out and posted by Friday. So thank you to everyone.
Thank you.
Thank you.
All right.
Thank you.